what I propose to do, ladies and gentlemen, is to give you one or two definitions about my subject for this afternoon. I will then tell you a little bit about my thoughts around psychology as it applies to your discipline. I will then mention one or two things about the Oral Health Federation. I will then embark on a journey for scaring you by telling you about your very own status of mental health, which I can tell you in advance is very poor. And then finally, and by way of justifying my invitation here today, I will tell you something about the nexus between mental health and your discipline, and we'll be trying to persuade you that in fact there are areas of synergy as we move forward. So let's start with the basics. And the basics here is, what is mental health? We know, you all know what oral health is, but what is mental health? Now, if you look at the last bullet point, it tells you a lot. It tells you that mental health is not the absence of disease or infirmity. It tells you that a mentally healthy person is defined positively as a person who is in enjoyment of a state of well-being. Let me emphasize that. You cannot be mentally healthy if you don't feel good. Secondly, you cannot be said to be mentally well if you have a sense that you have not achieved your own abilities. As our second president used to say, Mzee Moi, if you're one of those people who, wengine wakaenda, wengine matajiri, if you're a person of like that, then you cannot be said to be a person in enjoyment of good mental health. And thirdly, stresses will always be there. And I've said this multiple times. The best way to avoid daily stresses is to be dead. So if you don't want to be stressed, then mambo ni matatu. Ukae hapa, uende mbinguni, na hiyo ingine yote mnajua. The other component of good mental health is you must be able to work productively. As a human being, if you're not working in a productive way in the environment that you are in, then you are not in enjoyment of good health. So working productively is part of the definition of good mental health. And the last bullet point, and this is very, 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 very important, is that you must be able to make a contribution to your own community. If you behave like a goat and all you do is to eat grass, you yourself will be gingered and you will be eaten. So a mentally healthy person does what you are doing here. You call people together, organize a meeting, and contribute to your community. A mentally healthy person serves in their local church, serves in their local nyumba kumi, or whatever it is. A mentally healthy person is engaged on a regular basis in his community. You might wrongly think that poor mental health is uncommon. We looked in Kenya and have established that 11% of you here today, 1, 2, 3, 4, 11% of you here present unknowingly has a mental health condition. of one sort or another. The fact that you are not aware of it is the evidence that you are ignorant, not evidence that it does not exist. Many years ago, it was established that 25% of the people who attend any primary healthcare facility, by whatever description, and this is terribly important, particularly those who work in health insurance, 25% of all visits that have been made today to any primary healthcare facility in this country is on account of a health measure. And the clinical officer will diagnose something they call clinical malaria. And they will do a whole lot of investigations of stool, of urine, of chest x-ray, all of it to complete and total waste, because they have not been trained to ask simple questions like, uko kwenye hali gani siku hizi? Usingizi unalala? Hali ya chakula iko namna gani? Patients speak the language they expect you, the medical person, to understand. So they tell you tumbo, mugongo. They don't expect you to understand, I don't feel happy, I feel sad, I can't work well. Again, the science is very clear. And this is one of the things I would like those people responsible for any manner of health insurance to understand. 40% of people in a medical ward today has a mental health need. Now, whether that person is being treated for cardiovascular disease, diabetes, stroke, hypertension, whatever it is, the fact that the diagnosis has not been made is the evidence of the ignorance of the physician looking after that person. Again, the science is very clear. Depression leads to cardiovascular disease. If you have cardiovascular disease, the likelihood of getting into depression is clear. But much more importantly, it takes longer in intensive care if you have a cardiovascular event and also have a depressive illness, and so on. And here's a list of myths that maybe one or two dentists might carry. Some people think that mental disorders are rare. Yes, of course, if you don't know how to recognize them, you think they are rare. In fact, there are over 300 different types of mental disorders that are recorded. People say, yes, but it's very difficult to treat mental disorders. Of course it's difficult to treat. All conditions that come to you at the equivalent of stage 4 carcinoma are very difficult to treat. I'm here to persuade you, if I may, that actually treated early, mental health disorders and their relationship with dentistry are really very easy to recognize. Oh, nobody with a mental health condition can lead a normal, incurable nonsense. It is not true. Millions of people are functioning as dentists and other things while still under treatment. The key is early intervention. And finally, treatment is expensive. Of course it's expensive if you come late. Now, surprisingly, your profession has known for nearly 40 years that, in fact, there is a connection between mental health and dentistry. And the earliest paper that I could find was actually published back in 1987. And the findings must shock you. And they will shock you because they have not changed. In fact, I can stop my presentation right here and add nothing else in the rest of my presentation. Back in '87, we knew that dental practitioners were dissatisfied with their work because of the reasons that you have told us here. We also knew the weak agenda are boys. Bure completely. Weaklings. We also knew at that time that mental health disorders amongst dental practitioners lead to coronary disease. Nothing has changed. Nothing has happened. 1987, it was recommended that we should find ways of stress management for dentists. I'm still here preaching the gospel 40 years later. And the uptake of studies amongst dentists was so slow. There were only 10 papers published about the mental health of dentists in the next 1 a year. And perhaps you know that stigma in the Greek, in ancient Greece, was a brand or a mark for slaves and criminals. And that is what you have done to us. You have stigmatized my profession. It's my turn now to speak the truth to you. Now, I know you can't believe this, but I have worse news. The fish, they say, rots from the top. Look at the state of your teachers. Now, most of you here are... Chaurieno. These are the big and leading professors, yes, who teach dentistry. And they're not little fellows. Most of them have on average 9 years as chairs of departments. And in this particular study I'm looking at, the response rate was excellent. 38% of your professors confirmed having emotional exhaustion. Many of them described the Moi phenomenon. Oh, siwezi. Oh, mimi bure kabisa. Oh, nimewezwa. The last bullet point you need to look at, because burnout amongst these academics affects other members of staff in academic departments. Perhaps it's not obvious, but I did go to school. And I went to school in London as a young man at King's College or near about. And King's College has actually done well because they have this guy called, whatever his name is, Tim, who is a professor of psychology as applied to dentistry. In other words, at that level, it has been recognized and accepted that you need to understand psychology if you are to practice properly. And the same chap is a psychologist and an advisor in the Chief Dental Office of His Majesty's government. I have told you that I have really nothing else to tell you beyond what we knew back in 1987. And at that time, we knew that dentists suffer obesity and overweight, depression, backache, the same diseases that normal people suffer from, which is the good news, of course, because it tells me that dentists are nothing but just normal human beings. Now, so what are dentists doing about it? They are moaning and groaning. In a recent study, 18% of a large number of dentists in the United Kingdom said that if they had the opportunity, they would rather be general practitioners, practicing, treating diarrhea, vomiting, and conditions like that. A significant number had alcohol-related problem, and it is clear that your drinking, obesity, and so on is affecting your patient, not only from the smell of the alcohol you drink, but also because of your trembling hands. The declaration that there is no mental health without oral health is the next subject to which I will now draw your attention. And just in case you're thinking that I only know about the United Kingdom, I do know other things also. For example, it is clear, and this is true, when you look at no mental health without oral mental health, rather without, that it's actually a two-way affair. And I was really glad to see the attempt that you're making to improve the look of human beings, because the first thing most people see in a human being is their face, unless, of course, you're a gynecologist. I didn't say that. But the reality is that and I'll be demonstrating this to you, poor dental health leads to poor mental health and vice versa. And the science on this one is very loud and very clear. So the question is, how do these two conditions impact one another? They impact each other because of the quality of life. I mean, I don't know if one can be happy with poor dentition. It's detrimental and sometimes fatal to self-esteem. And a lot of people will avoid being in social company because of the terrible, terrible smells that they emit. This guy, professor I've told you about, is an expert in treating people who have fear of dentists. And the fear of dentists is real. And again, as I will be demonstrating to you, the more you fear the dentist, the worse your dental formula is. And the worse it is, the more you fear the dentist. And the more you fear, the worse it gets. And so is set a vicious cycle. I feel a bit like a priest on Sunday, preaching only to the converted. Only the converted go to church. So I'm already talking to you, and you're already here, and you're curious, and you're interested. But these are the specific conditions that are more common in people with mental health disorders. If you look at the last bullet point, I would like it to shock you. I would like you to understand that oral disease is now linked with Alzheimer's. Now, this is not Njenga's imagination. Now, I think I have persuaded you that there is an intimate relationship between dental care and mental health. The third bullet point is an important one. And again, this is from science. Not visiting a dentist is sometimes a sign that you're not well. And the converse is also true. Healthy people, according to the science that I have come across, visit their dentists. Shall I say that again? Visiting your dentist is evidence that you're in good mental health. Now, I will upset you a little bit by showing you a few numbers that will persuade you at the end of the day, I hope, that you need to look internally and that the decision that you have made of asking us to become your partners is a wise move. You have very high suicide rate, way above the already very high suicide rate recorded amongst doctors in general. The impression that we hold as normal people in the street is that all of you people have very stable, very secure jobs that pay very well, that you only work a few hours, and you enjoy causing pain in our mouths. What is the truth? The truth, again, as we have been told here, your job is a hard job, and sometimes a completely thankless job. So what is the effect of the thankless state that you find yourselves in? Dentists report high levels of stress. 68% were reporting very high levels of stress during COVID. And it has been recommended, and nobody to my knowledge has put that into effect, that dentists are entitled to exposure to some level of education in mental health, at the very least, so that they can look after themselves. Now, I would like to go to a dentist who has slept well. I would like to go to a dentist who is not smelling of alcohol. I would like to go to a dentist who is in full enjoyment of good health, as I defined it at the beginning. And the recommendation is that a little bit of exposure might be helpful to me as one of your clients. I've told you, I keep repeating myself, these are just additional, somewhat scary numbers. And the reason I'm giving you these numbers is to tell you, msiwe na wasiwasi. I've shown you the numbers from the United Kingdom. I've showed you numbers from Australia. I'll show them in a minute. I'll show you numbers from all over the world. And they all repeat the same things about high levels of suicidal ideations, way above doctors, moderate to severe psychological distress. And look at the last bullet point. Exactly the same as we found in Maseno. 11% of you here present today. 11% of you. How many people are here today? 400? And that is because you're normal people, don't worry. It gets worse. Again, this, you can look it up. All the references are here. It's not me dreaming. 17% of Australian dentists have been getting suicidal thoughts in the last 1 year. You want me to repeat myself? 31% of Australian dentists have thought of suicide during the course of their lives. Nearly 6% have attempted suicide. Now, these are serious numbers. And yet, because this is an elephant in the room, nobody wants to tell us that younger colleagues under the age of 30, babies, little babies like some of you here, have higher risks of mental illness than your grandfathers and your fathers. But I thought, what you really need to be doing is forget me and forget those two Aziz that I saw here. It is your younger colleagues that are in the gravest danger, if we are to believe the science around ourselves. Now, are we helpless bystanders, or are there things that have been shown in science as possibilities? Absolutely yes. There is evidence, look at the last bullet point, that actually consultations for dentists who have mental health needs are helpful. What else is possible? There's a large number of things that we can do. There is, for example, what we are doing here today. And the reason I am so privileged to be here in your midst today, now you'll say I have a delusion. Yes? I am here to preach a gospel that I hope you will find acceptable and even helpful. I'm here to persuade you that if you look at your mental health as individuals and as groups, you will enjoy good mental health, according to science, not according to Njenga. Now, we have been celebrating this month, throughout this month, the whole concept of mental health in the workplace. And let me tell you this. Toxic work environments are a leading cause, listen to my words please, a leading cause of death. You have seen it in this country. This is Kenya. Yeah, this is still Kenya. You have seen it in this country. Young professionals dying account of what is called a toxic work environment. And we can do something about toxic work environments. In the medical field, the worst culprits are surgeons. Surgeons kill their younger colleagues. And I'm not talking about things you have read in the newspaper. I am telling you about science. Incivility, treating younger colleagues without the human respect and decorum to which they're entitled, leads them to alcoholism, depression, and eventually suicide. With respect to secondary prevention, again with respect only to dentists, prompt and early detection is key. And you will not do this unless at this level you are aware that maybe it's a surprise to you. Dentists are human beings. And all conditions that human beings get, dentists also get. And then, of course, there is the tertiary prevention, which is what your president was talking about. Treatment, rehabilitation, counseling, and so on. Because of the very high numbers, there must be a system and a process of treating dentists. So now, with your permission, I will become selfish. And this is what is called a commercial. I am now bringing a commercial, because this is now about myself, or at least as a psychiatrist. Science tells us that our patients are difficult for you because you have not been exposed in your training to people who have mental health needs. And I am suggesting that in the course of time, it will be necessary and appropriate, and we are certainly going to be pushing this, that I would think, as we were saying earlier on, there has to be a dentist at Mathare Hospital. Because in any psychiatric hospital for that matter, because one of the things that people with mental health needs do is to neglect their personal hygiene, and in particular, their oral hygiene. And there are those people who now advocate for special training and institutions for dentists who understand mental health conditions. And these are the conditions that one gets when you have a mental illness. These tooth loss, periodontal disease, tooth decay, and so on. Again, not Njenga speaking, this is science speaking to you. And again, as I've told you, again, prospective studies confirm all that I have said to you. Now, let us consider Maybe some of you work in counties. Maybe some of you work in big government hospitals. The possibility of a psychiatric dental consultation and liaison services. Because really, the rates of oral disease amongst my patients is way, way above average for reasons that I have told you. So, I've done 28 minutes now. I've got just 2 more minutes. How do we conclude on this matter? Number one, you, my brothers and sisters, are exposed to high levels of anxiety, stress, depression, which finds expression in other ways, including drug and substance abuse. Number one. Number two, because of the special environment in which you find yourselves working in, 87% of British dentists self-report as suffering from one form of burnout or another. I don't know what you're going to do this evening, but I've seen an interesting young lady here telling you to go and dance. Look out for each other, because you are indeed your brother's keeper, for those of you who have a tendency towards addictive or problematic alcohol use. Poor mental health, so common amongst yourselves, affects the quality of care you give me as one of the people that you look after. And anything that affects my well-being is my business. And I thank you, Mr. President, for inviting me so that I can give you all this terrible news that I have given you today. However, the future is very bright indeed. Asanteni, my 30 minutes are over.